Imagine a silent invader settling in your stomach unnoticed, perhaps for years. This is the reality of Helicobacter pylori, a bacterium affecting nearly half the world's population. Most remain oblivious, unaware of this tiny guest impacting their digestive health. H. pylori infection is remarkably common, often acquired in childhood, yet it remains largely invisible in its early stages. This bacterium, with its corkscrew-like shape, is a master of disguise, cleverly evading our immune system. It burrows through the protective layer of our stomach, making itself at home. The stomach, designed to break down food, faces a new challenge, battling a persistent bacterial infection. This silent invasion, if left unchecked, can lead to a cascade of digestive issues, impacting individuals and public health globally. Take the case of a middle-aged woman for years experiencing vague digestive discomfort, dismissed as mere indigestion. Little did she know, H. pylori had taken hold, slowly causing inflammation within her stomach lining. Her story is not unique. Millions carry this bacterium, often unaware until more severe symptoms surface. Understanding H. pylori, its mode of transmission, and its impact is crucial, for it is a battle fought both at an individual and global level. H. pylori typically enters the body through contaminated food or water, often during childhood. This transmission highlights the importance of hygiene, especially in resource-limited settings. Once inside, the bacterium sets up shop in the stomach lining, triggering a chronic inflammatory response. Our immune system, though powerful, struggles to eradicate H. pylori completely. The initial damage is often subtle, gastritis and inflammation of the stomach lining. This can cause a burning pain, nausea, and bloating, symptoms easily mistaken for other digestive issues. Over time, the persistent inflammation can lead to more serious conditions. Peptic ulcers, open sores in the stomach lining, are a common complication. These ulcers can bleed, causing severe pain and potentially life-threatening complications. In some cases, chronic H. pylori infection increases the risk of stomach cancer. The constant inflammation and cellular damage create an environment where cancer cells can thrive. H. pylori infection is a significant risk factor for gastric cancer, a disease with a high mortality rate. Understanding the long-term consequences of this seemingly innocuous infection underscores the importance of early detection and treatment. Diagnosing H. pylori infection requires a multi-pronged approach. Doctors often begin by taking a detailed medical history, focusing on symptoms and potential exposure. Blood tests can detect antibodies to H. pylori, indicating past or current infection. This test, however, cannot differentiate between an active or previously treated infection. A breath test offers a non-invasive method to detect active infection. Patients swallow a urea capsule. If H. pylori is present, it breaks down the urea, releasing carbon dioxide detected in the breath. This test is highly accurate and often used to confirm eradication after treatment. Endoscopy, a slightly more invasive procedure, allows direct visualization of the stomach lining. During endoscopy, a thin, flexible tube with a camera is inserted through the mouth and into the stomach. This allows doctors to observe any abnormalities and take biopsies, small tissue samples, for analysis. Biopsies are examined for the presence of H. pylori and can also assess the extent of damage to the stomach lining. Treating H. pylori infection requires a combination of medications to effectively eliminate the bacteria. The standard regimen involves multiple antibiotics such as amoxicillin, clarithromycin, and metronidazole taken simultaneously. These antibiotics work by targeting different aspects of the bacteria's survival mechanisms, increasing the chances of complete eradication. Along with antibiotics, doctors often prescribe proton pump inhibitors, or PPIs. PPIs, such as omeprazole or lansoprazole, reduce the production of stomach acid. Reducing acidity creates a less hospitable environment for H. pylori and promotes healing of the stomach lining. The duration of treatment typically ranges from 10 to 14 days, depending on the severity of the infection and the chosen antibiotic regimen. Adherence to the prescribed medication regimen is crucial for successful eradication. Patients must complete the full course of antibiotics, even if symptoms improve earlier. Premature discontinuation can lead to antibiotic resistance, making future treatment more challenging. After completing treatment, a follow-up test, such as a breath test or stool antigen test, is recommended to confirm eradication. Early detection and treatment of H. pylori infection are paramount in preventing severe complications. Untreated H. pylori infection can lead to chronic gastritis, peptic ulcers, and an increased risk of stomach cancer. Timely diagnosis and effective treatment can halt the progression of the disease and prevent long-term damage to the stomach. Public awareness about H. pylori, its transmission, and its potential consequences is crucial. Educating individuals about risk factors, symptoms, and the importance of seeking medical advice for digestive issues can facilitate early detection and intervention. Healthcare professionals play a vital role in identifying individuals at risk and recommending appropriate testing. For those diagnosed with H. pylori infection, understanding the importance of adherence to the prescribed treatment regimen is essential. Patients must be informed about the potential consequences of incomplete treatment, including antibiotic resistance and treatment failure. Open communication between healthcare providers and patients is vital for successful management and prevention of complications. Preventing H. pylori infection centers around interrupting its transmission pathways, primarily through contaminated food and water. Practicing good hygiene, including thorough hand washing, especially before meals and after using the restroom, is paramount. Consuming food and water from safe sources is crucial, particularly in areas where sanitation may be compromised. Parents and caregivers play a vital role in instilling good hygiene practices in children from a young age. This includes teaching them to wash their hands properly, avoid sharing utensils, and consume food and water from reliable sources. In areas with limited access to clean water, boiling water before consumption or using water filters can significantly reduce the risk of H. pylori transmission. Public health initiatives focusing on improving sanitation infrastructure, promoting safe food handling practices, and raising awareness about H. pylori are essential in controlling its spread. These efforts are particularly crucial in developing countries where the prevalence of H. pylori infection remains high. By implementing comprehensive prevention strategies, we can protect individuals and communities from the silent threat of H. pylori.